Okay, so I'm here with Maria. We are at our 12-week checkup. It's a little bit longer than 12 weeks because you took some time. Did you go on vacation?
Vacation. I was on vacation in Puerto Rico.
Okay, so you took about a month, a little bit over a month out there, and now we're at our 12 weeks. Can you tell people just why did you come to see us in the first place?
Well, I have a problem with neuropathy, and that was diagnosed by my neurologist.
Yep.
And so I asked her because I continued to have some pain and just didn't feel right, and she suggested taking medication.
Yeah. What was the medication? Gabapentin.
Gabapentin.
Yeah.
And I looked at all the side effects, and I said, I'm not interested in this. And so I called her immediately and told her I was going to take it. Then I went to see my internist, and I asked him, I'm having problems with neuropathy. My doctor recommended this medication, and he said, try it.
Okay.
It works on 50% of the people, and it doesn't on others. So
Yeah.
just try it. Go ahead and try it. And in the meantime, my sister saw an article in the paper about your services
Yeah.
and your treatment, and
Yeah.
that just sounded so much better. No medication.
Yeah. Yeah, so
So
that's
that's
what you were
why I
looking
came
for.
here.
You were looking for something without.
And that might work.
Yeah.
Because in both cases, the doctor said it would not. It would just help relieve pain.
The symptoms.
Yes. Symptoms.
Yeah, and that was gabapentin, right? That they
Yes.
had suggested. Okay. Yeah, and that's usually kind of the go-to for most patients that are suffering from neuropathy. So, so you really didn't even get started over there, but you were looking for more of a holistic approach, something that was gonna hopefully start to heal the nerves.
Correct.
Yeah. Okay. Okay. So, how did just share briefly? How did your on your end, as far as what you were feeling? How did your condition respond to our treatment?
Well, pretty quickly, I could feel more sensitivity in my feet.
Yeah.
More flexibility in my feet.
Mm-hmm.
And so that was very encouraging. I wasn't tired.
Yeah.
I'd walk a little more
Yep.
each day. I could walk a little more.
And when we had started, I remembered you had said one of the things that we typically will do is set some goals, kind of some functional goals. And we had set out that we wanted you to be able to walk for about half an hour without having a lot of pain and having to stop. And at the time, do you remember how far you were able to walk before?
I could get to the 30, but I was in a sweat.
Okay.
I was so tired. I was exhausted. Couldn't do much else the rest of the day.
Okay.
And now I can do the 30.
Yeah.
Fairly easily.
Yeah.
And I have increased another 15 minutes in the evening.
Awesome. Awesome. That's wonderful. What would you say your overall experience has been just with the program in general?
I would recommend it, and I have recommended it to other people.
Yeah.
Because again, it's not a medication, and it has provided the relief that I was looking for.
Yeah.
Everyone else said, no, take this pill.
Yep. Yeah. And we had talked about this, before you'd seen your neurologist, your internist. Did you ask them about like any alternatives? Did they suggest that there was anything else that?
No. Only a physical therapist had indicated that there was something called capsaicin. Capsaicin.
Yes.
And that would create a burning and should help restore, but
Yeah.
some people found it effective and some didn't.
Yeah, and that is another thing that's I guess that's just a good example of there are other options, right? Capsaicin's a natural. That's what they find it's in pepper.
Yes.
And it basically depletes your nerves of what's causing the pain. So for some people it works pretty good, but why didn't your neurologist or your internist suggest that? Because that's a possibility. What would you say to somebody, because there's a lot of patients that we see that they're looking for something, but their doctor told them, don't waste your money, don't try something else. There's nothing else out there that's going to work. What would you say to those people that are hurting and they're looking for options?
I would say it's really worth the time and the money. There's a cost associated with it, but it's worth every penny to me.
Yeah.
I'm 70 years old and I want to keep walking and traveling.
Yeah.
This was giving me that option.
Yeah, and that was one of the things that you'd said from the very beginning, like that was important to you and that you wanted to be able to do those things. So we're happy that we're a small part of that, and it's been a pleasure working with you, and we're looking forward to even better results.
Thank you, doctor.
Thank you.